Every October, we drown in pink. Whether it's handguns or bagels, we're surrounded by the color. We must address the corruption of Breast Cancer Awareness Month, and how we can collectively rise above it to truly create positive awareness and knowledge about this deadly disease. While breast cancer awareness has decreased the stigma of the disease and increased research funding, there are some problems with it. Namely, companies are gaining money and marketing power from their pink campaigns, some of which are only donating fractions of their profits to research, if anything at all. Many of these very companies are selling dangerous, cancerous products. Now we have enough awareness. We need more information on prevention and detection, something decidedly lacking in Pinktober. Every October, we're bombarded by pink campaigns. Whether this is in the NFL, KFC, M&M, jewelry stores, department stores, the list goes on and on. This does more to sell products and make money for these very enterprises than it does to support breast cancer prevention or research. Many times, they promote their products as solely raising awareness. They make tons of money off these sleazy marketing schemes, preying off of our good intentions. Some of these companies are supplying products that lead to poor health and breast cancer or other cancers. They have known carcinogens in their product, yet they're purporting to be helping the problem. They're selling their product, putting a pink ribbon on them, all for the purposes of improving their image. They don't think that we, the consumers, can see through their marketing schemes, and right now the truth is that most of us can't. The bottom line is, if you want to buy a pink hat from the NFL, buy it, enjoy it. But if you want to donate money for breast cancer awareness or research, donate directly to the institution that fits with your values. I've listed quite a few organizations in the description with different approaches that you can choose from to support. Now, to get to the most important part, what you can do to lower your risk of breast cancer. Prevention and detection. There's currently quite a debate in the scientific field about certain factors that may increase or decrease your risk for breast cancer. The following pieces of advice we're taking from sources including the famous Mayo Clinic, the CDC, the Center for Disease Control, the American Cancer Society, and the ancient Indian medicinal practice of Ayurveda. Staying fit, eating well, and getting regular exercise are an important part of staying healthy and potentially minimizing the risk of developing breast cancer. Breastfeeding may play a role in breast cancer prevention. The longer you breastfeed, the greater the protective effect. Physically massaging the breasts leads to better lymphatic flow, which may decrease the chance of breast cancer. Make sure to use a chemical-free natural oil such as castor, coconut, or sesame oil. This will help you detect any physical changes in your breast tissue, something to be followed up by a medical professional. Increased alcohol consumption is linked to an increase in breast cancer. Accumulating evidence suggests a link between smoking and breast cancer, particularly in pre-menopausal women. Some studies show that women who wear bras are more likely to develop breast cancer. Wearing a bra can prevent normal lymphatic flow within the breast tissue, leading to less oxygenation of the cells. Cancerous cells thrive in these anaerobic environments. Consider going braless, at least in your home and elsewhere if you are able to. Certain environmental factors may increase your risk of developing breast cancer. Do not put your cell phone in your bra or anywhere near your breasts. We've seen at least a few incidents of young women developing breast cancer just from storing their cell phones in their bra. Long-term exposure to electromagnetic radiation has an effect on our health and can cause cancer. Avoid chemicals that have damaging hormone-changing effects. These include compounds found in plastics, including BPH among others, certain compounds found in cosmetic and personal care products, including phthalates and parabens, and certain chemicals in contraceptives and hormone replacement therapies. Certainly, many people do everything right and still develop breast cancer. So the next most important thing is detection. Mammograms are recommended for most above a certain age, but they might not be right for everyone. It's important to know your breast density. Those with dense breast tissue may be better off with a different type of test, including ultrasound, MRI, thermography, or MBI alone or in addition to a mammogram test. Once again, massaging your breast may help early detection of a lump or tumor. Please also refer to your doctor or the many online information toolkits that are available to make an individualized plan for you. In order to help the scientific community find more about this disease and its causes, find a clinical breast cancer prevention trial and be a part of it. I included a link in the description, or find one in your area at a local hospital or clinic. Speak to friends and relatives about specific steps they can take to reduce their risks of developing breast cancer, and about how to screen for potential problems. Now you know about the many problems of the current breast cancer awareness marketing schemes, how to help by donating directly to a charity that is aligned with your views, and specific steps you can take to prevent and detect breast cancer. Together, we can make a difference. Thank you.